Welcome. For those of you who don't know me, I'm Phil Rosori. I'm the medical director of Village HopeCore for 18 years, and I wish I could be with you today, but we are now using our new YouTube channel that's dedicated to HopeCore, and this is the first time I'm using it to be able to actually communicate with my team in the field. Most of you know me. I will be there. I come once or twice a year. I will be there in July and August, and I will have a chance to speak to you in person. But the advantage of this YouTube channel is that anywhere in the world, anybody who has internet connection can access these videos. Now, the reason for the video today is because in the next 2 weeks, HopeCore is going to embark on an incredibly important thing as we begin to teach the teachers to become health champions in the schools. Now, historically for our organization, for those who don't know, 18 years ago, Dr. Mugambi, myself, and 12 women met on a hot, dusty afternoon to start HopeCore. We had very little money, very little chance of success. Things were very bad in the village as the HIV epidemic was ravishing HopeCore. You may have heard me say that in the year 2000, the main street at HopeCore was filled with coffin sellers, and we began our program, and 18 years later, you can see what's happened. So why is this so important in these next 2 weeks? Well, basically, as you know from the prior videos, what we're attempting to do then is create one healthy mother raising one healthy child, and over a generation, if we have enough healthy mothers raising healthy children and teaching healthy children about health, you end up with a very healthy society, or a society much healthier than the one that's in Kenya today. Now, this is important because in the year 2050, there is going to be probably 80 to 90 million people in Kenya. When I first went to Chagori in 1987, there were 18 million people. Today, there are about 45 million people, and will double again by 2050. Now, mid-century, 2050 is not that far away. My granddaughter will be 34 years old and in the prime of her life in 2050. So what we're attempting to do now is to plan ahead so that those generations of children that we teach now and those mothers will become the mothers and the grandmothers of the children of 2050. So the training then of trainers is critically important. The first trainer, of course, that we have started with is the mother. As she trains the child, as she learns about healthcare, then she imparts those ideas, those concepts within her child. The second kind of trainer is actually the child himself, who is going to learn about healthcare topics, and then when they get into the standard 7 and 8, then they join health clubs, and then they take that information, school to community, back in to their homes, their extended families, their neighborhoods. So they become junior community health workers for HopeCore, and with our new program with the teachers, we plan to expand that program. And the next, though, important trainer is the teacher. And after all these years, we've finally gotten to the position where we partnered with the Ministry of Education to actually begin to train health champions in every school. This may be historic in Kenya. We're not sure if it's been done before, but whatever, what we're trying to do here is make health and health topics an integral part of the curriculum within our school system. Now, obviously, we want some responsibilities out of these health champions. One, they're going to be responsible to take care of the water tanks, which means to be sure that the water tanks are treated correctly, that they're washed every month, that they have water guard in the tanks, and that they keep up the logbook. And they're also responsible for the soap with the hand washing tanks. We want to make them that one of their responsibilities. One of the basic operating procedures we would like them to educate within their schools regarding is to educate each of the teachers within the schools to the fact that any child that goes out to use the toilet facilities must show evidence of washing his or her hands before she returns to the school. So that is extremely important. And then when we do malaria education and bed nets, that's important. When we do worming, those teachers are going to be involved in that. When we talk to mothers and preschool children in the afternoon regarding vitamin A, the teachers may help with some of this as communicating with the parents, and particularly the mothers. So the teachers then become extremely important. We want to make those teachers feel that they are truly pioneers, that they're doing something totally innovative in Kenya and heroic in the sense that just like the first group of 12 women that I sat with 18 years ago to start HopeCore, they left that initial session and chose the name the Ranchege HopeCore Pioneers. They understood that if they were successful, they could change the way health and development was done in their whole area. And 18 years later, that's actually what has happened as we now access 50,000 some children in our school district, and all their mothers and their brothers and sisters. So somewheres between 100 to 130,000 individuals are officially in our program. And the ability of having the teacher to help train these children is going to actually be very critical. We're going to try to work with those teachers and do things for them to make them want to be part of our program. I'm now trying to find funds so that we will be able to train these teachers every time the school has a break. Because if this program is really going to work, we're going to have to keep them interested and to keep training them and to keep increasing their level of sophistication, their ability then to teach around healthcare topics. So certainly we're going to want you to convey the importance of the things that we want them to do, the importance of clean drinking water, the importance of hand washing with soap. As you know, we found this is a problem as many people rinse their hands with water. They don't wash their hands. But we know from a health standpoint that rinsing your hands isn't enough to get the virus and disease-causing bacteria off your hands. You really need to wash your hands, and this is critically important, not only for children, but for mothers as they begin to prepare food in the household, take care of their younger children, etc. So these things are extremely important. But the other thing I want to talk to you about is what I'm calling this finest hour concept. And this is, of course, the finest hour speech Winston Churchill gave to the people of England during the severe London bombing early in World War II, when he simply said, if the British Empire lasts for 1,000 years, this will be your finest hour. That ability then to make them understand the bigger picture in London, to make them feel heroic, then is absolutely critical in their ability to resist and survive the initial bombing of London. In a very similar sense, we tried to convey to the first 12 women 18 years ago that they also could be heroic in moving these ideas of development and health along, and they did that. So what I'm asking you to do as my army, my soldiers in the field, is to convey that to those teachers, that this is innovative. We're not sure anybody is doing it in anywheres in the Ministry of Education. We're not positive. Naomi's going to be looking into this. But whatever, if there are school districts that have this, they're very few and unlikely to do it the same way we're going to do it. So your ability then to show them that they are doing something that is heroic is going to be extremely important in the next 2 weeks. And in a very real sense, you're health champions. You're the ones that are going out to the community and bringing these health topics into the schools, into the child maternal health clinics, into the market days, into the Celebrate the African Mother and Child. And certainly the children that are in the 30 or 40 health clubs that we have right now then also become health champions as they take from school to community the ideas of clean water, water guard, soap, back a 24-hour health hotline back into the community. And now these new 200 teachers will extend that as they also become the extension of you, the extension of our team, and they become health champions. You are the soldiers. Naomi is my field general, and I'm the one responsible for designing the program and being sure that you get paid every time your paycheck is due. I have to be sure that we have money to pay you, and we will do that. We are going to expand the program, and this is a very exciting time. I wish I could be with you. At least this YouTube channel allows me some participation. You're going to see more of me now that we have this channel. I teach a lot in the United States, and it's always been sad that because I'm so far away, I rarely get to teach my own employees, my own people who are working in the health department. So we're in the process of changing that, and that will move ahead. I look very much forward to seeing you this July and this August. So when you go into those schools in the next 2 weeks and talk about clean water and hand washing and getting the teachers to support those things and getting the teachers to start and understanding the importance of health clubs and how we can use the students to go out and train their own parents and their own extended family and to use them as junior community health workers, which is a way to consolidate the students' own knowledge about health and then spread that knowledge to their families and extended families. So I think when you go in to talk to those teachers, you can be proud of what we've done. You are pioneers. This is the first time we've tried this. It may be the first time in Kenya. So I anxiously look forward to hearing about this. I will support you. I will support this financially. I will find money to train these teachers during the times that the schools are off. I'm trying to find money so that we can create self-help micro-enterprise groups so that we can do something for the teachers. I think the more we can do for the teachers, the more likely they are to really take this seriously. So if you can impart to them for me that this is their finest hour, that we're trying to change how health education is done in Kenya. As you know, from your own education, there is very little health education within the curriculum in the 12 million school children in Kenya. We're about to change that. We've already started with you going into the schools, and now we're taking a step forward as we actually have one health champion teacher in every school. So good luck. I look forward to seeing you in July and August of this year, and also hearing from Naomi what happens in the next 2 weeks. All right, have a good day.